Time once again for a look at what is making headlines in the field of heart health. Joining me in studio today is Charles McDaniel, registered nurse at Baptist Memorial Hospital, Memphis. And Charles, welcome to Smart Medicine's Heart of the Matter.
Glad to be here.
We're glad to have you here today. Now, we're here today to talk about something called the HeartMate 2. What is that?
Well, it's a new generation rotary blood pump designed for patients with advanced heart failure.
And what is the difference between the HeartMate 1 and the HeartMate 2?
Size and longevity. The HeartMate was about a pound. It was a pretty big device. Patients had a lot of discomfort with it. So over the years, they came out with the HeartMate 2, which, as you can see, is a much smaller device. And the bearings in the HeartMate 2 are lubricated by the blood going through the device. So it's actually marketed as a 5 to 7 year pump compared to the HeartMate 1, which was marketed as a 2-year pump.
And who can get the HeartMate 2?
The HeartMate 2 is designed for patients that are bridge to transplant patients. They're actively waiting on the transplant list. And in 2004, they came out with a category called destination therapy. So for patients that aren't transplant eligible, but they meet a certain criteria, they can get the HeartMate 2. If they're too old for a transplant, but they meet a certain criteria, we can implant the HeartMate 2 into them.
And how many of these have been implanted? And give us an idea of some of the outcomes.
Worldwide, there's been over 4,000 HeartMate 2s implanted, and the outcomes is that survivability has increased. For patients with class 4 heart failure that are medically managed only, there's only like a 12% survival rate. But when you put the HeartMate 2 in them, that number goes up to 58%. And currently, there's one patient that's been on the HeartMate 2 for over 5 years. Also, survivability is important, but you also have to look at their quality of life. So you're taking a patient that can barely walk from one part of the house to the other without stopping several times to rest, and they're sleeping on 4 or 5 pillows propped up at night. We're taking that patient and getting them back to somebody that's like you and me. They can walk through the mall, they can go to the grocery store. On a 6-minute walk test, they're walking about 4 or 5 football fields without having to stop to take a breath and rest.
A remarkable difference. What a great piece of technology. Now, how long has this been available in Memphis?
We started in the FDA trial study in 2005. 2008, we got FDA approval for bridge to transplant. And in January of 2010, destination therapy was FDA approved, so it's now commercially available for the public.
And how can the public learn more about HeartMate 2?
If they want to learn just about the device itself, they can go to Thortec's website, www.thortec.com. They can learn about the device, how it works, how it operates, and there's also a link to Heart Hope, which will get them connected to a VAD center closest to them. And if they want to learn about Baptist's program, they can go to Baptist Online and go to Baptist Memphis to contact us, and they can send us an email, and we'll get back in touch with them, send us their contact information.
Well, Charles McDaniel, thank you for sharing this with us about HeartMate 1 and 2.
Glad to be here.